Hello and welcome back to the Diabetic Desk by yours truly, Charity Onyonyi. I'm the founder of this platform, and I'm so happy that I took a chance and started this because I feel like this is an area that I'm passionate about. So this comes easy. So please subscribe to my YouTube channel and let's get into today's business. So in today's session, we're going to talk about something that has always received enough attention in diabetes, and that is kidney health. And yesterday, being 12th of March each year, we celebrate World Kidney Day. So I feel like it was an important reminder that metabolic health and kidney health are deeply connected. So diabetes is one of the leading causes of kidney disease globally. Just go look at the risk factors. Diabetes is usually among the first one. Yeah. So I feel like many people only hear about this risk after they've been diagnosed with diabetes or they are pre-diabetes and all that. So in this session, we're going to explore how diabetes and pre-diabetes affects the kidney and why this risk develops and why early awareness can make a meaningful difference. So I decided to amp up my slides with materials from yesterday's World Kidney Day. I hope you celebrated it. I hope you created awareness. I hope you shared. So leave in the comment, how did you do it? Is there an activity? Us as the Nutritionist Corner platform, we had a wonderful session yesterday with Grace, and I feel like I'm happy we get to contribute to such a global topic and conversation and just keep it going. And World Kidney Day is just not only a one-day thing, because kidney is on the rise. So you're going to look at more about this. So we're going to look at why this conversation matters. So like I said, kidney disease is a global health concern and an emerging one at that. Millions of people worldwide are living with reduced kidney function, and many cases are linked to metabolic conditions such as diabetes, hypertension, cardiovascular health. So one of the challenges that kidney disease often develops gradually. Like you might just be looking at me, we're looking at each other, we are walking out there, and we don't know we are having a reduced kidney function. Yeah, so that is one of the major challenges and something that came up during yesterday's World Kidney Day. So in many cases, individual may not notice any symptoms, but though you don't, until significant damage has already been done. You go to get a told you have acute kidney injury, or you have the early stages of chronic kidney disease. We're going to look at that in the later slides. So this is why understanding the connection between diabetes and kidney health is so important, guys. I feel like that's why there's a day dedicated to that. So early awareness allows for earlier prevention and better long-term outcome, because I feel like when they catch it during the first second stages, it can be reversed, but when it's captured when it's stage 5 or end stage kidney failure, sometimes it can be hard to pump up your kidney. So we're going to look at the roles of kidney. Of course, you have to understand where all this is coming from, and for us to understand why kidney affects kidney, I mean why diabetes affects kidney health, it's first to good to understand the functions in our body. So I feel like kidney plays a vital role in maintaining a balance within the body, like that small bean organ that is just below your abdomen area, like above. uh, let me just leave the image so that you know where the kidneys are located. So they help in filtering waste product from the blood, removing excess fluids from the urine, regulating electrolytes such as sodium and potassium. That's why when you have chronic kidney disease or you're on dialysis, these are some of the electrolytes that are really of major concern, supporting blood pressure regulation, producing hormones involving in red blood. So those products on you. Let me leave the word. I cannot embarrass myself, guys. So kidney filters approximately 180 liters of blood per day. Yeah, that's how you know why kidneys are very very important. And when the kidney you lose kidney function, major functions of the body are affected. So we're going to look at what chronic kidney disease is, because that is what was highlighted majorly in World Diabetes Day yesterday. So one of the most common kidney conditions associated with diabetes is chronic kidney disease, and chronic kidney disease refers to a gradual decline in kidney function over time. Like it just starts, that's why they stage one, two, three, four, five, and then end stage, and then total kidney shutdown, and then you will need transplant or be on dialysis. So when kidney function decreases, the body becomes less efficient at removing waste products in the blood, maintaining fluid and electrolyte balance, progressive damage of kidney tissues. So these processes often occur slowly, like in the definition, it's a gradual loss of kidney function over time. So many individuals may not realize that kidney function is declining until routine tests are done and it's detected. So this is why screening and monitoring are very, very important for people with metabolic risk factors. If you've subscribed to this channel, I have been putting out videos to explain to you what metabolic syndrome are and what the cluster involves and how they intertwine. And kidney disease was among the intertwined. Yeah. So that's why we have to talk about what chronic kidney disease is. So we're going to look at the relationship between diabetes and kidney disease. So persistent high blood glucose level can damage the small blood vessels in the kidneys, nephrons, if I'm not wrong. So over time, this damage affects the kidney's ability to filter blood effectively. So this condition that develops as a result of diabetes-related kidney damage is called diabetes nephropathy. And in diabetic nephropathy, eh, the filtering units of the kidney, known as glomeruli, become damaged, and this can lead to leakage of protein into the urine and progressive loss of kidney function. So globally, diabetic nephropathy remains one of the leading causes of kidney failure. That's why it's very, very important to know the role diabetes play in the kidney disease and where they intertwine and their relationship. So I hope you've understood that. We're going to look how high blood pressure, no, high blood pressure, how high blood sugar damages the kidney, because hypertension is also a risk factor. I wish I could talk about this, but we'll see. How high blood sugar damages the kidneys. So when blood glucose level remain elevated over a long period of time, several biological changes often occur within the kidney. So high glucose level can damage the delicate blood vessels that make up the kidney's filtration system. So I'll try to leave the image of what I'm talking about so that you can be able to understand, even if you didn't do the sciencey part of it. So this can increase pressure inside the filtering unit and promote inflammation and oxidative stress. So over time, the affected tissue may develop scarring, like pneumonia, um, which further reduces the kidney's ability to filter waste product effectively. So this gradual process explains why kidney disease is considered a long-term complication of diabetes. That's why when you have diabetes, type 1, type 2, any form of diabetes, we really look at how well you're controlling your blood sugar through your fasting blood glucose level, and importantly your HbA1c, because if you don't control your sugars very well, what I have explained will occur, and then it will lead to kidney failure or kidney damage. Yeah. So we're going to look at why prediabetes still matters, because originally the episode that was supposed to be up was all about prediabetes, but that episode will go out next week. So although kidney disease is commonly discussed as a complication of diabetes, go look at the long-term complication of diabetes. I'll leave them on the screen. The underlying metabolic changes often begins earlier. Like I said, it's a gradual process. So in prediabetes, the body may already be experiencing insulin resistance and metabolic imbalance. So these changes are and can be associated with elevated blood pressure, like I said, inflammation, and metabolic syndrome. Go look at the episode where I talked about metabolic syndrome. So all of these factors can place an additional strain on your kidney function. Yeah, so this is why it's helpful to think of kidney health as part of a broader conversation about metabolic health. And just to leave you with this point, kidney risk often begins earlier than many of us really realize. So when you're told to go get your blood checked or do a routine checkup and you say, oh, mi bado ni mdogo, so be on the lookout. Yeah. So we're going to look at the shared risk factors. So diabetes and kidney disease share many of the same risk factors. That's why there's an intertwine and that's why there's a relationship. This includes central obesity, hypertension, like I said, sedentary lifestyle, and family history of metabolic diseases. Yeah. So these factors often interact with each other rather than occurring independently, like when I explained to you. So, for example, like I said, having excess abdominal fat can contribute to insulin resistance, which can in turn influence blood pressure and lipid metabolism. We talked about lipid and triglycerides, so you understand when I say that. So, over time, this combination of metabolic stressors can increase the likelihood of both diabetes and kidney disease. So, some of these risk factors are modifiable and some are non-modifiable. So when you see at central obesity, that's a modifiable risk factor that can be changed. Sedentary lifestyle is a modifiable risk factor, but family history, aging, those are non-modifiable risk factors. So you have to work on your modifiable risk factors to reduce your risk. Yeah. So we're going to look at metabolic syndrome and kidney risk. So another concept that helps this relationship in the metabolic syndrome world, metabolic syndrome, I told you guys, refers to a cluster of condition abnormality that tend to occur together. So this include abdominal obesity, elevated blood glucose levels, high triglyceride, low HDL cholesterol, and elevated blood pressure. I don't talk more about this. The last episode I talked at length about this, so go watch that episode. So individuals with metabolic syndrome are at a higher risk of developing both type 2 and chronic kidney disease. I already defined for you guys what chronic kidney disease. I hope you've understood. So this cluster of risk factors reflect underlying metabolic dysfunction. Yeah. I'm trying my best to smile at the experience so that we can be able to be on the same page. So we're going to look at early warning signs. We've already understood what um, kidney disease is, the chronic, and its relationship with diabetes, pre-diabetes, and how they come and intertwine to put you at risk of getting kidney diseases. So one of the challenges with kidney disease is that it often develops silently, like I said in the first slide. In its early stages, there may be no noticeable sign or symptoms, to be honest. Some of those people who are diagnosed with chronic kidney disease, they will tell you they didn't feel anything. However, healthcare professionals may detect early warning signs through laboratory testing. That's why you're told to go and get checked. When you get to a certain age, just go for your routine checkup, please. This may include presence of protein in your urine, albuminuria. Hizi maneno za science ulishinda kupronounce. Changes in the kidney filtration rates, rising blood pressure, swelling of the legs and ankles, edema sometimes. Yeah. So because these symptoms may not appear until later stages, routine monitoring plays an important role in prevention. So that's why I'm highlighting the importance of early screening. Yeah. So we're going to look at screening and early detection. So regular health screening can help identify this metabolic and kidney risk early. You know, when you catch something in the earlier stages, preventative measures can be put in place to reduce the risk of the progression. So some of these key tests used in clinical practice include your blood glucose testing, HbA1c measurement, blood pressure monitoring, urine albumin testing, estimated glomerular filtrate rate, the EGFR. If you have someone living with chronic kidney disease and stage and they're going on dialysis, you'll be able to understand what glomerular filtrate rate is. Yeah. So this just helps assess your kidney function. So these tests allow healthcare providers to detect early changes before more serious complications develop. That's why screening and monitoring is very, very important. Yeah. So we're going to look at prevention and protection. So, protecting kidney health often begins with addressing the metabolic factors that contribute to kidney strain or acute kidney injury. So, maintaining healthy blood glucose level, controlling your blood pressure, engaging in regular physical activity, that is reducing your sedentary time. Check how much or how long you sit down without walking, your physical activity levels, and all that. I feel like these are important preventative steps. Improving your dietary patterns and maintaining a healthy weight can also support metabolic balance. When you go to the World Kidney Day Organization website, they really give I will leave their what is it called? Their posters and the materials campaign that was used for yesterday. You can see they were telling you some of these risk factors to kidney disease or kidney health, how to improve and all that. So these same strategies are often recommended for diabetes prevention too, because like I said, kidney disease is one of the long-term factors when you have uncontrolled blood sugars in terms of diabetes. So these overlaps highlight how closely kidney health and metabolic health are connected. So I hope you've understood the relationship. I've taken you through a journey, so I hope you'll be able to get it. So we're going to look at connecting to the World Kidney Day theme. Of course, I have to tell you the theme for last this year, like that yesterday. The theme was kidney health for all, caring for people, protecting the planet. So this message reminds us that kidney health is not only as a medical issue, not to think of it not only as a medical issue, but also part of a broader public health and prevention effort. So supporting metabolic health through education, like I'm doing, early detection, and healthy environment can play a meaningful role in protecting your kidney function. So I hope you been able to understand. I know I've tried my best not to talk too much sciencey and use analogies when explaining, because the technical side of diabetes and kidney usually just loses people. So I hope you've understood this episode and you'll share this episode with more people to get to understand how diabetes, prediabetes, and kidney health are intertwined. So as we close this episode, I want to tell you guys, kidney disease is often discussed as a complication that appears later in the course of having or living with diabetes, but the metabolic processes that influence kidney health may begin much early, like you've seen. Understanding the connection between prediabetes, diabetes, and kidney functions allow us to focus more strongly on prevention in terms of screening and early detection. And by recognizing these early warning signs and addressing these metabolic risk factors, we have an opportunity to protect long-term health. So here at the Diabetic Desk, the goal is to encourage early awareness, deeper understanding, and meaningful prevention.